So diagnosis of endometriosis is a little bit tricky because the only diagnostic way to do it is diagnostic laparoscopy, to put a camera in, get some of these cells and look under the microscope. But of course we are not going to do this for every woman who comes with pelvic pain or painful period. But we can narrow this in terms, first of all, the exam, the pelvic exam. With the pelvic exam, there are some features that we can see that actually narrows our diagnosis. Okay, this might be an endometriosis. Like there are some pain or nodules inside the pelvis. The pelvis, usually the uterus should be floating inside the pelvis. It doesn't have to be thick or stiff. One of the best ways to diagnose the endometriosis is to examine the patient. And unfortunately, some people, like pelvic pain, okay, they don't examine the patient. And that's the main way to diagnose the patient, first is examination. The second, there are some ultrasounds that we can order to try to narrow our differential diagnosis. So if we see some features of the ovary, this can tell us, okay, this might be an endometriosis, like an ovarian cyst that looks like an endometrioma or chocolate cyst. This can narrow our diagnosis, okay, this patient might have an endometriosis. I have seen a patient last month who had this bowel issue for 5 or 6 years, and then she did a colonoscopy. They did a biopsy from the colonoscopy, it came back to be endometriosis. But again, that's not the usual way to diagnose it. It's not to do a diagnostic laparoscopy, it's not to do a colonoscopy, it's to do an exam and ultrasound. Sometimes we use MRI if we are still suspicious.